Welcome everyone to the Invisibly Aware Series meeting. Today we're going to be doing a presentation on autoimmune conditions and what it's like to live with some of them. We'll have some brief information on some of these conditions, and then we'll also move into a Q&A session with two of our guests who can talk more about their experiences. Now, before moving on with the presentation, there are also some important disclaimers that we need to give. The information that we're discussing during this meeting is not medical advice. If you have any medical questions or concerns, please consult your doctor. It's also important to keep in mind that every person with any particular condition is unique, and even among individuals who have the same diagnosis, some might not have exactly the same experiences as another due to a variety of reasons. Additionally, please also know that we are not experts on these topics, and even though we have researched them and read about them pretty well, our guest speakers are much more knowledgeable and often on their personal or professional experiences with the illnesses that we'll be discussing.
Alrighty, so I'm going to quickly introduce myself. My name is Morgan. I am a white woman with long brown hair wearing a green sweatshirt, and I'm going to briefly touch on some of the conditions we're going to be covering today. So we will be discussing autoimmune diseases, and so as a general description, autoimmune diseases are a group of conditions in which the immune system attacks the body's own healthy cells, and it often impacts multiple organs and different body systems. And for risk factors, people who are assigned female at birth tend to have autoimmune diseases at a higher rate than those who are assigned male at birth. It is a relatively common group of conditions, with about 15 million Americans suffering from autoimmune diseases, and there are also over 100 known autoimmune conditions. One of the conditions we will have a speaker for tonight is lupus. And lupus is a chronic condition that causes inflammation and pain. There is four different types of lupus. There's systematic, cutaneous, drug-induced, and neonatal. Lupus is also known by SLE, and it can affect the kidneys, brain, skin, and joints. And it is a relatively more common autoimmune disease affecting about 1.5 million Americans. And common symptoms include butterfly rash, hair loss, widespread pain, joint swelling, fatigue, and brain fog. Our next condition that we're going to have a speaker for tonight is antiphospholipid syndrome, or APS. And this is a condition where the immune system mistakenly makes antibodies that attacks tissues, which can lead to the creation of blood clots in the body. It is often caused by autoimmune conditions, but can also be triggered by infections, hormones, cancer, and sometimes also genetic predispositions. For symptoms, or rather complications, people can develop deep vein thrombosis. They can have pregnancy complications, stroke. They can have a TIA or a mini stroke. They might have rash, headaches, cardiovascular diseases, or deficiency in their platelets. It is a more rare autoimmune disease with about 5 cases per 100,000. It is also more common in those assigned female at birth, and it is also more common in people who already have pre-existing autoimmune disorders such as lupus. In those cases, it's known as secondary APS. So I'm going to go ahead and just briefly introduce our guest speakers for tonight. So we have Raquel, who you can find at Lupus in Color on Instagram, and she is the founder of Lupus in Color. And then we have Angela at lraven.xo on Instagram, and she has APS, and she's also a CTEPH advocate. So we're going to go ahead and jump in. If you all wouldn't mind just briefly introducing yourselves, just giving a quick background on who you are, anything you want to know or share with the group right now. If we could start off with Raquel, that would be great.
Hello, everybody. My name is Raquel, and I have had lupus for over 21 years. And it started as rheumatoid arthritis. So we'll get further into that as we go. I founded Lupus in Color, which is a global support group to help other people understand what lupus was in their bodies and things of that nature. For the record, I am a Black woman. I have dark brown hair, and I'm wearing a purple hoodie shirt.
Hello, everyone. My name is Angela L. I am a Hispanic Latina woman, light skin, who is currently very red, part of that rash that kind of comes, a little bit of flushing. I'm wearing a black actual romper, but you can't see that, so you only see the black shirt. My hair is light brown with some like I like to call them, some silver highlights coming in. And I'm currently wearing it down in ball.
Wonderful. Thank you both so much for briefly introducing yourselves. So, our first question here, I'm just hoping that you all might be able to share a little bit about your experience living with an invisible illness. And you might want to talk about when you started experiencing your symptoms, what type of symptoms you had, as well as maybe a brief description of how your condition affects you. If we could also start with Raquel again.
I knew you were going to start with me. um, well, my lupus became apparent after I moved from a larger city. I used to live in New York, and we were moving to Virginia. And about a year later, I started exhibiting issues with my hands, extending my arms, opening and closing my hands, my feet, and things of that nature. When I went to the doctor, it was stated that I had rheumatoid arthritis that could possibly lead to lupus. So 2 years later, lupus pretty much attacked my intestines, and it gave me ascites, which is the swelling of your intestines, and leaked 4 liters of fluid into my belly. First brush with death. And that was the final diagnosis of lupus. So it seems like I kind of condensed that in a short little time, but it was a long period of time where there were so many things going on as far as my health is concerned, with the rheumatoid arthritis, pleuritis in my eyes, and things of that nature. Being put on medications that didn't really work, you know, going back and forth and trying to figure out what works for my body, where medications were actually harming my body more than they were helping them at the time. So that's a shortened version of my story, my run to lupus in its entirety. With lupus, I also, like I stated, I have rheumatoid arthritis, and due to steroid use, I also have type 2 diabetes.
Thank you for sharing. I really appreciate you walking us through that. And I definitely understand, as you're saying, so many comorbidities and complications kind of piling on top of each other. I feel like that's a common theme we see with a lot of our speakers here. So thank you for sharing. And then Angela?
Yeah, so I was diagnosed with antiphospholipid 10 years ago. I was actually diagnosed when I had a stroke. And my story is a little wild. So I had two hospitals miss my stroke. The first one I had been at for a whole week being treated for pneumonia when I started experiencing TIA. And they said, honey, you just got anxiety. And they discharged me, and I had the stroke in the car. I went to a second hospital. They didn't recognize it as a stroke. As you may know, women a lot of times we present differently with stroke. So I didn't have the droopy face or the slurred speech. I had what I would describe as the worst headache of my life, as well as some vision changes in my right eye. And then when the stroke happened, I went completely blind in my right eye. And so it's still completely gone. I have no vision in that eye. I was pregnant at the time, and it was my first pregnancy, and it was pretty early on. And I went into what is known as CAPS, that's catastrophic antiphospholipid. So I had blood clots all in my body. They honestly did not think I was going to survive. They asked me if I wanted to freeze. Like you, Raquel, you had that. That was my first brush with death. I was in ICU for about a week. I did make it out, obviously, miscarried, and I got told I couldn't have kids as a result. I They first told me it was APS, and with APS, you have to get two positive tests at least 12 weeks apart for the official diagnosis to come. So they tested me and they said, it looks like this, but we got to wait 12 weeks and retest you. So they did. And in hindsight, I think I was probably having clots a lot earlier than that. I had episodes going back at least 7 years where I was struggling to breathe, and they kept telling me it's asthma, it's allergies, it's your weight. And they kept throwing me on prednisone, which, as you Raquel know, that can has a whole host of problems. Prednisone also can make you gain weight. So, 7 years of that, and I put on even more weight. The following year after my stroke, well, I'll back up. So, because I was misdiagnosed, I started being an advocate online and sharing my story because I didn't want what happened to me to happen to any other person. And I do think, and I'm sure we'll get into this, but I do think being a woman and specifically a Hispanic woman played a role in that dismissiveness of the first two hospitals. The following year, I was struggling to breathe. I ended up in the hospital for a minor surgery. They couldn't put me under anesthesia because my oxygen saturation was too low. And I was sharing this online. My doctors kept me a week in the hospital. They ran a whole series of tests. They couldn't figure out why I needed oxygen. So I shared that story online, like, hey guys, we're all going to be on oxygen 24/7. We don't know why. I happened to have an old high school friend who was a heart surgeon who saw my post, and he wrote me and he's like, I think you have a really rare disease called CTEPH. It stands for chronic thrombotic pulmonary hypertension. And so with his help and with my advocacy, and I really did have to push my doctors for it, but 6 months after he told me he thought I had it, I was formally diagnosed and I was given less than 2 years to live unless I could go have surgery out in California. So I did that in 2018, but I lived 9 months not knowing if I was going to have the surgery or die. So I was preparing for both because I had to wait until I got there. And the soonest they could get me was 9 months. So for 9 months, I was preparing both for the surgery. I was in pulmonary rehab, but I was also preparing to die. And that's a really weird space to be in. I did have my surgery. It got me off oxygen 24/7. However, I had to go back in 2022 for 3 rounds of balloon angioplasty to address the distal clots in the lungs. And that really did make a big difference. My APS is mostly well managed, although it does occasionally cause complications. I do have to get weekly blood draws for my INR check, and I am kept at a much higher INR range than most patients. Most patients are kept 2 to 3, and my range is 3.5 to 4.5. I think that's
Wow.
I covered.
Yeah, no. What a powerful story. I'm so sorry to hear that everything you went through, especially, the dismissals and like as you said, you being a female and your Hispanic race, feeling like those influenced your care. And I'm sure we'll definitely touch on that a little bit more in depth later because I think that's something we would like to highlight as well. But thank you for sharing your story, and I'm happy to hear that things are at least a little bit better managed now, and you've made it somewhat through the other side. So.
Thank you.
Yeah, thank you for sharing everything. Like Morgan has been saying, it's very difficult living with chronic illnesses, just getting diagnosed for everything you're experiencing, being validated with what you're feeling by your own doctors. Would you both be also able to share with us your journey? I know you both touched on them, your journey to getting diagnosed, but if you were to also tell us more about your emotional reaction to receiving the diagnosis once you were finally at the point where you received diagnosis, to explain everything that you were experiencing health-wise and how long it took to seek help after noticing these symptoms, like sort of a timeline. I know both of you guys have already provided that, but I guess if we could talk a little more on that.
For me, when I was first diagnosed with rheumatoid arthritis, I'm a former athlete. I've been to 2 different Olympic trials. So I was coming in here to Virginia like healthy. At least I thought I was. But in New York, I was moving. I mean, I was going from 6 a.m. to 2 a.m. So it was something that was, not given an opportunity to show itself. But when I moved to Virginia, my body kind of slowed down. My life slowed down. I had a 3-year-old, and it was just something that happened because I think my body just was able to catch up with itself, so to speak. So when I was diagnosed with rheumatoid arthritis, it kind of was a blow to my ego because, like I said, I was an athlete. And I was like, how am I supposed to take care of my 3-year-old and deal with this new chronic illness going on? I was also a social worker. It was just so much going on that it was overwhelming. So the first thing I felt was overwhelmed. And then as my disease progressed, within the 2 years from the diagnosis of rheumatoid arthritis to lupus as well, I think I felt like lost. And that's what prompted me to really figure out, how can I deal with this? And once I got to that point, it wasn't even an issue for me anymore. It was like, okay, I have this disease. How do I handle it? What do I have to do? I'm not going to sit in this sadness and this overwhelming feeling all of my life, because they said it's lifelong. So when I was finally diagnosed with lupus and was hospitalized, I just was like, okay, y'all told me that it could turn into that. So I was pretty much prepared, but I didn't see anybody that looked like me in my town. So I had to do something about it. And I think that kind of shifted my focus from woe is me to I have got to get out there and show everybody what the heck this is, so that nobody else feels as lost as I was. So it's such a gamut of different feelings that you go through when you're diagnosed with any chronic illness. But I went from overwhelmed to I have to do something. And I think I've stayed in that I have to do something to make sure that, I can actually cope with it. That's just part of my coping skills.
Yeah, thank you for sharing that. Your life, anyone's life completely changes after getting a chronic illness diagnosis and just going about your life differently. So your story is really empowering.
So for me, can you ask the question one more time? I'm sorry.
Of course, no worries. So it's about, I think, just modeling how Raquel framed her story. If you could talk about how your life has completely changed, who you were before, and now how your illness and your experiences dealing with your illnesses have transformed you into the person you are right now, and how you're going about it now.
Yeah, so like I said, I think leading up to the diagnosis, I'd been struggling with my health for a while. And I remember thinking, like, why is everything so hard for me? Like looking at other people around me, and I'm like, how are you doing this? Like, I don't understand, because my body is like struggling to keep up. And especially once the breathing trouble started. And then when I had the stroke, I'll be honest, it was shock. Like I didn't, like if you looked at me, I didn't cry. Like I didn't, and it all happened like at the same day. So like the stroke, the vision loss, the pregnancy loss. It was all in one day. And like I didn't shed a tear. I didn't have any emotion. Like when they came in and they're like, "Do you want a priest?" I was just like, no. They I mean, one, I'm not religious, but that's its whole other thing. But at least not in that sense. And I think it was just shock. I was just in a state of shock. And it was survival at that point. And it probably took me about a week to have emotions um, to hit me, right? It was when you're in the hospital and you're in the ICU. And I mean, they told me to say bye to my husband, say bye to my parents. Like I was, and I didn't, because I don't know, it was just that shock. Um, so, when I got the diagnosis, the official diagnosis 12 weeks later, I kind of wasn't surprised, because I was kind of already like, okay, this is probably what it is. And so really at that point, it was me learning. And how did I cope? I've been a yoga practitioner since the 90s, and yoga has always been something that I've leaned on. And I found that after my stroke, I leaned in even harder. And it wasn't about the physical practice; it was the um, the space to allow me to feel and to have emotion and to process what I'd been through, and to just be present with this body, and also be like, okay, I survived, and I'm grateful for what this body can do. Um, it was a lot of learning of kind of like, with APS and you're on Coumadin, Like you have to stay balanced in what you eat. You can't like, you can drink, but you can't like drink a bunch one weekend and then not drink for 2 months. You have to stay consistent with food and alcohol. And so there was a little bit of a change there. The vision loss that happened. So I'm a professional photographer. I am. I just do it differently now. But when I had my stroke, I was at the top of my game. I was internationally published. I was winning awards. I was traveling all over the world. I was doing destination weddings. And I actually remember being in the hospital and I had to call the bride who I was booked for like, I don't know, I think it was like 5 weeks in the future. And I had to be like, hey, I had a stroke. Like, I can't fly. I don't even know if I'm going to survive. And so that was a big hit. And, you know, after I tried to come back to my photography, and I always say, you only really need one eye because you're behind the camera and you shut one eye anyways. But being in front of a computer is harder because the one eye gets tired. And I had to stop doing weddings. Like I realized I couldn't do anything that required a solid commitment for me because I never know how my body is going to be on any given day. And so it did change the course of like my career. And it took me in directions I never imagined. And, you know, I sometimes tell people, and I know some people struggle with this, is it was a gift. It was literally a gift of perspective. Like it literally changed my perspective, but like not just physically the eye, but my perspective on life. And you know, for me, I think like Raquel, I realized that my way to cope was to raise awareness because I was angry. I was very angry at the hospital and the nurses that told me, honey, it's anxiety without a neuro check. And at that point, I really trusted the doctors, and it it made me realize that I am my own best advocate and that I needed to help other people realize that too. When the CTEPH diagnosis came in 2018, so that was about a year and a half after the stroke, I remember the pulmonologist took me in and he was like, okay, you know, you have CTEPH. And I broke down crying, which was a totally different reaction than the APS. And I was like, you mean I didn't do this to me? And he was like, why would you say that? And I said, because for years I thought I did this to me with like gaining weight. And he's like, no, he's like, in all actuality, you probably gained as much weight because of your illness and because we kept throwing you on prednisone. And because as it got harder for you to move and exercise, yeah, your body changed, right? So I had a very emotional reaction to that diagnosis of just realizing like there was an answer and there was a reason and there was a sliver of hope because at that point I was told, you know, yeah, I only had 2 years to live in my current state, but the hope was that I could be a candidate for surgery. And so I just kind of put my mission in that. And I really worked on not just the physical, I was in pulmonary rehab, but also the emotional and the spiritual, the mental. Like I did yoga a lot, I meditated a lot. I really focused on like getting myself ready for what was to come, even though I didn't know what was to come. And then through all this, I've just really been passionate about advocacy because, you know, these diseases aren't always well known. And especially like CTEPH, I've actually been in medical professionals, been with them, and they've never heard of CTEPH, or they're like, you're the first patient I've ever met with it. And that's pretty cool in a way, but also kind of not cool, you know? So I get to be the one to educate. I'm actually, my doctor is at a teaching hospital. So it's not uncommon that they literally bring all the residents in to see me. And they're like, all right, this is what she has. And okay, Angela, let them have it, like share what happened. And they also kind of use me as a teaching moment in that you can't make assumptions and that you need to look at all avenues before you dismiss someone because they recognize, my doctors now recognize that what happened to me was, it was missed by medical professionals and that shouldn't have happened. And so I like that they're using it as a teaching moment to hopefully help the new up and coming medical professionals. And I'm hoping that we're going to see a change in the culture there too.
Yeah, definitely. And I think that's something you both touched on, especially I think recognizing who you were before your illness and after. I think it's such stark changes for a lot of us who have chronic illnesses. And I think in a way, like you almost grieve that life that you had and going through those stages of change. Like, as you mentioned, there's the grief, the surprise, the shock, the not even having a reaction at first, possibly, right? And eventually getting to that point, though, where you feel like you're in a position that, you have to do something with this. I can't be the only one like this. And you're not the only one like this, right? And how using that platform and opportunity to share it. And while your experience is unique to you, just spreading that and just bringing awareness to the fact that this does happen and hopefully helping to prevent other people from going through the same thing. So I think that's really powerful in both of your stories. And thank you for being such strong advocates and sharing your story because I think it's important that, future healthcare professionals and other patients and other people in general hear that this is happening and this is reality for many people. So for our next question here, I'm curious to hear more about, I guess, more of the treatment side of things. So is there any specific approaches, treatments, medications, and you don't have to give a whole list, but maybe a couple things that worked very well for you, whether that's good or bad?
You know, what I found is that my treatment has changed from when I was diagnosed 21 years ago with my body. So we might have started on something that, maybe prednisone or, a steroid or something like that, or immunosuppressant that worked until it didn't, until my body changed, until something happened in my body to say that doesn't work for you any longer. So it's been a journey, not just to get a diagnosis, but a journey to get the treatment that actually works. And once you get a treatment that works, hoping that it will work for the rest of your life because it's a lifelong illness. Um, but of course, we've just changing treatments is just such a difficult thing because you get to a point where you're so afraid to try anything else. And that gives you that fear and that uncertainty that can really mess with your psyche. You know what I mean? It can really mess with you as far as how you live day to day and how you walk through your days. And it's just very difficult. So immunosuppressants, prednisone, steroids, all of that kind of worked until it didn't. And then finally, I was put on a biologic, and that was what actually stabilized me. And with chronic illness, you don't only have to deal with that chronic illness. You have to deal with other life issues, other physical issues. Um, by the time I got to the biologic state, I was, and this is going to be quite graphic. I was bleeding for 18 months and not bleeding like spotting. I was bleeding like a full menstrual cycle for over 18 months. Lupus had started to attack my uterus, which led me to almost just bleed out. Um, when they when we finally were able to set up a time for me to get a hysterectomy, I couldn't even wait the time out because I was sent to the hospital, ash gray. The guy was like, I don't know you, but you are gray. And I was passing baseball-sized clots. And that was on medication. And, sometimes I think that as someone who has a chronic illness, we do everything that we can to make sure that this chronic illness does not take us out. We're going to go out fighting, until the wheels fall off. But we can do everything that we can, take all of the medication correctly, take it on time, be very compliant with your medication regimen, and still have issues like that. So after I got that whole uterus out of me, which was the size of a volleyball, so I'm sure it's somewhere in somebody's medical, paperwork and things of that nature. Once I got that done and had 4 liters of blood pumped into me, blood transfusion. If you can give blood, please do so. I think that kind of settled out my body a little bit from what was going on. So it made it easier for the biologic that I'm on to actually begin to work. And even like I said, even though you're on these different medications and you try different things, because that's what it is, trial and error. Nobody knows everything about every chronic illness. And even us who have the chronic illnesses don't really understand it. So everything is trial and error. And once I got to the biologic state, that has been what has been keeping me pretty stable. I still have my flares and everything like that. Like I'm in a serious flare right now. But, it kind of stables me out. It doesn't make the flare so long. And it kind of helps me to live a kind of somewhat normal, what people think is normal, because my normal is something totally different than someone who's healthy. So once I went through all the different things, and I have to tell you, as you age, I'm over 50, as you age, your body is going to change, which means your medication regimen is probably going to change. I'm in total menopause, and hormones and everything will change those medication regimens. So it's been a long journey, but it takes a long time to get the treatment that really helps. And then you have to make sure that your doctor is on board. You know, like Angela was saying, she was taking the doctor's voice from it. But after a couple of years, you know your body, and you need to start to work in partnership with your doctor so that you know exactly how to talk to them and exactly how to persuade them to help you get to the treatment that you really, really need, and that will help you the most.
Yeah, those are really meaningful insights. It's tough when you get the diagnosis initially and you have no clue what to do, no clue how to approach anything, and trying new medications, even in the middle of your journey, can be really daunting because you don't know if it'll make your condition worse, if it'll throw everything on its head, or if it'll actually help you. So, yeah, it's tough and long.
Parts of it would be, so not only do you have to worry about your own health being, kind of compromised from it, but what are the side effects? Well, how are we weighing out the benefits? So it's
Definitely.
so much.
So much to think about, yeah. And then it's not just you, there's other people in your life. You're also leading a normal life like anyone else. There's so much to think about, so much that gets impacted with a chronic illness.
So for me, the main medication I'm on is Coumadin. Um, the the thing that's hard about Coumadin is, and I don't know if y'all have heard this, but with APS patients, the finger sticks that they use they aren't accurate for APS patients. In fact, the most of the makers of those devices have come forward and said it shouldn't be used with APS patients. Now, I have met some APS patients who are like, oh, it's fine. And I'm like, that's cool if that's like, you do you, boo. Like, I'm going to do me. I know for me, I have an amazing hematologist who manages my APS. I love her dearly. I've been with her for 10 years. And at one point, she said, you know what? Do you want to try it? She goes, I'm willing to try it, the finger stick. She goes, but here's my stipulation is for 6 weeks, I want us to do a finger stick and a lab draw within an hour of each other and see if they match. So for 6 weeks, we did that. And what we realized is it never matched, not even close. Like the finger stick would be like 5.8, and then the lap draw would be like 3.5. So if we had gone off the finger stick at 5.8 and they lowered my Coumadin, I would have been at a risk of clot because 3.5 is the low end of my range. And so we tried it for 6 weeks. We realized it didn't work. And so as a result, I am at the hospital every week getting blood draws. The other thing about being on Coumadin that makes it difficult with APS is like any fall or any injury, I am at a risk of bleeding. You can see I've got bruise right here, and I have no idea where that one came from. I've constantly got bruises, and I don't know where they come from. And any procedure, any surgery is harder for me. So this year, I've had fistulas. I don't know if y'all are familiar with those. Those are real fun. And I had to have two colorectal surgeries. And a normal person, my colorectal surgeon said, a normal person would come in and it would be in and out same day. Like you wouldn't need a hospital stay. But being on Coumadin, I have to bridge. So I have to come off my Coumadin, bridge through Lovenox, which is the injections in the stomach. Then I'm admitted to the hospital and I'm put on a heparin drip because heparin has a shorter half-life. So when they do the surgery, they take you off heparin for a short amount of time and then they start it back. So the first surgery I went in for, I got stuck in the hospital for 2 weeks, and that was not fun. I will also share that I've got medical PTSD because of my experiences, as I'm sure many chronic illness patients do. So mine is heightened by hospitalizations because that's where I was dismissed. So when I'm in the hospital, I'm very like, I'm not sleeping, I'm hyper aware. And they also, what I've realized is doctors can't treat me like their protocol for like stopping someone before a surgery on heparin is to stop someone for 6 hours before the procedure. That doesn't work on me because of how fast my body wants to clot. And so my doctor is like max 4 hours. In fact, I only want it stopped 2 hours before the procedure. And then you have the procedure, and that's the next 2 hours. You can't be off of heparin for less than 4. So anytime I go into a hospital, I'm literally like fighting the medical staff of like, you need to check my records. You need to look at my note from my hematologist. I understand that's your protocol, but that doesn't work with me. And so that's been kind of difficult. As far as other medications, they have at one point talked about an immunosuppressant, but that has its own, drawbacks. It's kind of like you said, Raquel, it's like weighing the cost versus benefit. As far as the CTEP, at one point I was on sildenafil, and I was having a lot of GI symptoms, and I kept going to my doctor and saying, I'm having GI symptoms. She's like, I don't think it's that. I don't think it's that. And this went on for like almost a whole year. And it took me literally printing the side effects from the manufacturer, highlighting all the GI symptoms I was experiencing. And I took it into the office and I slid it over and I said, I've highlighted all the symptoms I'm experiencing that are documented from sildenafil. And she pushed it aside and she said, honey, if you just lost some weight, most of your problems would go away. And I was like, and we're done. And that's something else I really try to teach other people is it's okay to fire your doctors. Like if you aren't getting the care that you need, it's okay to say like, you know what, this isn't working for me and go somewhere else. And so at that point, she was the only PH doctor in my city. And so I started driving 5 hours to Dallas, 5 hours one way. So it was a 10-hour trip round trip to go see a PH specialist up there. And I did that for 2 years until San Antonio got a new PH specialist. And so once we got a new local PH specialist, I saw him, I felt good about it. So now my care is back locally. So that's kind of been my experience. Something I want to add with Raquel is like, I really appreciated what you said, because something I say all the time is I think that more people need to see, and not just us as patients, but also the medical professionals, we are in collaboration. Like this isn't us versus them. Like we're in collaboration for my care and my health. And if you treat me as dismissive, as like, I don't know, oh, you just Googled, like, no. If I'm gonna like research something, I'm off in the medical journals. Like I know how to research. And so I am doing my due diligence. And so when I go into a doctor with stuff that I'm trying to present to them, if they immediately dismiss me, I know that's not a collaborative care and I'm not interested. So I'm like, I'm going to find the doctors who understand that this is a collaboration, that you and I work together to get me as healthy as possible.
I think that's a great point, Angela. Oh, sorry, Raquel, were you going to go?
Right.
Okay.
We're probably going to make the same point because it's so important. I tell a lot of people when I talk to them that you need to be friends with your doctor. And that's a broad statement, but I need to be able, I can go into my doctor's office and say, look, doc, I got this water on my butt. I need you to look at it. And I'm not embarrassed to say it. I'm not, he's just like, okay, drop your pants. Let's just see what's going on. You want to make sure, like Angela said, that collaboration is there and that you feel that you can trust that doctor. And because you're trusting him with your life. He's making these medical decisions based on his expertise, and you're making these medical decisions based on how you know your body. So you need to be friends with your doctor. I'm not saying you need to go hang out and have a pint of beer or anything like that, but you do need to be able to joke around with your doctor. You need to talk to your doctor. You need to communicate as openly as you can, because a lot of times as a person with chronic illness, you're so afraid to say what's going on because you're afraid to hear what it might be. So having that good partnership with your doctor makes a world of difference in your care.
100%. And yeah, that's what I was gonna say. Like add to that in addition, like with that's a lot of what we're trying to do here is bring awareness. Like one of our main messages, as you heard in the disclaimer, is that we like these people know their bodies themselves. They know their stories the best out of anyone. And with that knowledge, accompanied with us hopefully help educating future healthcare professionals, they can see how valuable hearing both perspectives from the patients and their stories and how that needs to be partnered with this education to come up with a collaborative care plan. And so I think that's really great that you both echoed that in that point because I think it rings true for all of us as patients, but also something for us to keep in mind too for any future healthcare professionals as well. So thank you for sharing.
I was just going to add that so that doctor who didn't want to take me off that medicine, I stopped that medication and all my GI symptoms went away. So it was the medicine. She just didn't want to hear it. But yeah, and that's, that's why we have to be our own advocates is sometimes I always say doctors know a lot, but they can't know everything about every disease. Like how many autoimmune diseases do we say? Like over 100? There's no way they can know everything. And so they have to be willing to hear our perspective. And we have valuable information that they can learn from. And if you have a humble doctor who recognizes that, then you can have that collaborative care.
And you have to be honest. You have to be honest with your doctors. You have to be honest with yourself. It's almost like a change of mentality. You have to change the way you are looking at a doctor. Because I think most of us, have grown up to say, oh, they are the expert. And we have to change our own mentality to say they are the expert. They have the education behind them, but I have the body and I'm the one that's going through it. So a change in mindset really happens. I think Angela mentioned it earlier that she had to change the way she was looking at it and her perspective. And with changing of that perspective comes a change in mindset and how you deal with doctors.
Definitely. So for our next question here, we want to hear more, and I know you guys have both touched on this kind of in your responses already, but curious to hear a little bit more about what challenges you faced within the healthcare systems, maybe workplaces even, but in terms of support, lack thereof. I know we kind of talked about some of the systematic things and experiences you had with some of these providers related to, I know female gender has been brought up as well as racial disparities. And so if you wouldn't mind maybe sharing a little bit about some of your experiences in some of those areas, that would be really, really wonderful.
Go ahead, Angela.
Okay, I'll start. Yeah, so I truly believe that there was multiple things that made me get dismissed. Frankly, I don't think they would have told a man, honey, you just have anxiety. I also think being a Hispanic, Latino, whatever term you want to use, woman, and I know I'm white presenting, I can recognize that, but I know when a doctor has my chart, they can see my full name, and I do have a Hispanic name. And I didn't even think about it that deeply until like a year after when I was sharing my story, and some paramedics were like, and I was like, what? And they're like, well, there's like a really awful inside joke that Hispanic women put the panic in Hispanic. And I was like, what? Like, I had never heard that, but I guess it's some kind of inside joke within some medical people. And that just like made me irate because I think in hindsight, I think also being Hispanic, they just saw me as hysterical because when I was in that first hospital, I'd been there for a week. And when I woke up that morning, I have just the worst headache of my life with vision changes in this eye. And I kept paging them and they would come in and they'd say, like, no, you're fine. And they would leave. And then an hour later, I'd page them again. I'd be like, no, something's wrong, like really wrong. I don't know what it is, but it's wrong. And they are like, no, no. And so that went on from like 5 in the morning until like 3 in the afternoon. And by 3 in the afternoon, the head charge nurse came in and said, honey, you just got anxiety. You've been here a week. We're just going to let you go home and you need to sleep it off. And I trusted them. And so, yeah, I truly believe that. And I also think, in some ways, my pregnancy, the fact that I was a pregnant woman, that it was my first pregnancy, that they really were like, oh, you're super anxious. Like, it's your first pregnancy and yeah, you're just nervous. And so I think I kind of had like multiple things. And I also think my weight, I think especially with the lung disease, CTAP, I think that my weight and, when they first started telling me it was my weight, I was about 100 pounds thinner than I am now. And yes, that is still overweight for my height. However, it wasn't nearly the weight I am now. And I was struggling to breathe. But I think that doctors a lot of times will use that as like, and I get it. It's like when you hear horses, I'm sure y'all heard this. When you hear when you hear hooves, think horses, right? But like sometimes it's a zebra. And I was that zebra. And they kept trying to be like, oh, it's just this, it's that. So yeah, that was a real struggle with that. And then, like I said, the lung disease, I don't know if my own doctors would have figured it out. I am very lucky. You say the universe had my back because my old high school friend who I hadn't talked to in a decade just happened to see my Facebook post and he wrote me and he was like, he's like, there's things you're saying that are like putting little red flags up for me. And he's like, I can't not share this. He's like, if it's nothing, it's nothing. He's like, but there's something inside me that tells me, I think you have this. And then, taking that to the doctors, I was a lot of times dismissed. They had either never heard of it or they were just like, it's really rare. And it really took me being pushy. And I mean, I was always polite, but I was pushy. I can be pushy polite. And it really also my friend, he was literally telling me because with CTAP, there's a sequence of tests in a certain order you have to go through to get the diagnosis. And so he was giving me the terminology and the language and the actual like tests that I could go and ask for. And that's why they all just thought, oh, you're just on Google. And I was like, actually. And then, as soon as I mentioned a heart surgeon friend, then they kind of changed their tune a little bit. They were willing to take me more seriously at that point. But yeah, it's definitely been a journey to be taken seriously, and I think it still is. I have, I'm sure like you, Raquel, I have many specialists. I have really great relationships with some, like my hematologist, and I've had others where I'm just like, at one point I was getting evaluated for I think it's MCAS and POTS. And that doctor was like super dismissive and, kind of even like laughed at me. He was like, you've been on the internet. And I was like, yeah, we're all on the internet, buddy. I was like, I mean, I don't know what person won't be curious and want to explore. And, if they take that as whatever, I'm like, yeah, that's not my doctor, right? So, but yeah, I think that race, gender, I think all of these things start to play a role when we look at our unique identities. And the fact of the matter is the medical community is still dominated by, mostly white men, mostly older white men. And I think that's changing. I see it changing, especially with the younger generation of doctors. And that makes me really excited.
I think visibility is definitely increasing for both patients and doctors who are also from diverse backgrounds who are able to recognize how people in their own communities are affected by various illnesses. And that's just creating more awareness to other doctors who are not knowledgeable on how presentation can be different in different people. So thank you for sharing your specific experiences. It's very illuminating.
I'm going to be a Debbie Downer because we know systemic racism has been ingrained in the medical system. So when they see a Black woman, when they see a Hispanic woman, when they see a Black man, or whatever the case may be, it's already inherent in them to be biased. Okay. And that bias is shown in how they treat you. One thing that I have experienced is the being called aggressive. No, I'm not aggressive. I am advocating for myself. And if you can't handle that, then I don't need you to be the doctor for me. And that becomes an issue because sometimes they think that women are not educated enough to even understand what's going on. And when you're looking at a person, you don't know what their education level is. And you don't know exactly how far they went within that education. So you can't talk down to them. And that's what a lot of Black women that I've been dealing with as well have found is that they're talking down to them. They're dismissing their issues. They're saying, oh, you're not in that much pain, or you can't be in that much pain and still be walking. And we know that that's all in that systemic issue that has been ingrained into that medical system. And that's never going to go away. I love that we're having more doctors who are, indicative of different races and things of that nature, but that is still ingrained in them when they come into that medical experience. So you find yourself fighting a bias, number one, racism, number two, and number three, you having to deal with being sick and having to advocate for yourself in a room full of people who do not believe you and or who think that you can take that pain better than the white woman who just left and they gave medication to. And then to go into the whole medication issue, a lot of time being a Black woman, they won't provide you with medication to help you with pain. And a white woman will say the same levels of pain, and they're automatically given that medication. So it's so many different things that a lot of people don't even realize that me as a Black woman would have to go through every time I walk into a room. How Angela has to fight just because her name indicates that she's not, the stereotypical, person that comes into their office. And you're judged on that before you even walk in the room. There was a thing with kidneys when they were giving kidneys transplants, and for years, decades, Black people were judged differently for those kidneys. And just recently, it's almost 2026, just within the last year, they have, struck that particular test down because it was biased towards Black people. So these are still major things that we're dealing with. We're also dealing with Black people or people of color or of different nationalities are not in clinical trials. So the medications that are being used, that are being successful in a white man or a white woman, we don't know what's going to happen. One of the biologic that I'm on, I'm pretty much the trial because they did not have enough Black people or Black women in those trials. So you got a whole nother issue of, racist tendencies and not being offered the opportunity to even have a trial given to you because of that systemic racism. So it's so much that you have to deal with. And it's not just Black women, it's Hispanic women, it's Indian women, it's every woman, as as we see, women are going through most of these issues, and women are being dismissed and being biased against and being racist, being just put out there as someone who is not believable and not ready to hear what's really going on. So, I always tell people, you go in there knowing that this can happen, but then you arm yourself appropriately with the appropriate words, like Angela said. A doctor says, oh, you don't have lupus, you have mixed connective tissue disorder. Well, what's your differential diagnosis with that? You can't just come at me and say A, B, C, and D and didn't give me a list of how you actually came to that conclusion. We want to learn their language so that when we walk in there into those rooms with doctors that might have some biases, that they understand that we know what we're talking about and we're going to advocate strong enough for ourselves so that there is no doubt about whether I have lupus or something else.
I just want to add, you brought up, you're totally right, because it doesn't really matter if the new doctors coming in don't have that racist ideology. They're in the system that has been racist for years, right? And one example I use is pulse oximeters were never tested on darker skinned individuals. And so those often give you misreads. So someone who has PH, who is a person of color, could be hypoxic, but they're not showing it because the instrument was designed for a white person. And you mentioned that you were called aggressive. I hear feisty, and I think that kind of goes to like our ethnicity, our race, right? It's like the stereotypical, like, oh, angry Black woman and feisty Latina. Like, these terms are used, they're weaponized, really. And so you're right. Like, even if the people change, the system is still there, and they're still operating within that racist system.
Absolutely. And the only way we can combat that is to educate ourselves, speak their language, and make sure that they understand, hey, I'm not here to play around with you. This is my life. And if that makes me aggressive or angry, so be it. Whatever. Do what I tell you to do.
All right, so to wrap up our meeting tonight, we have one more question for you guys, and that's if doctors, it has two parts. So if doctors were to know one thing about your condition, what would you want it to be? And the other part is if the public were to know one thing about your condition, what would that be?
I mean, for the doctors, I would say you're not always right. They just need to know that they're not always right. They don't have all the answers. They really have to listen to the person and create treatments for the person, not the disease. Because everybody who has lupus, like I have, it presents differently in their lives. And because we're of different nationalities, because we have different makeups in our bodies, we're going to be treated differently as far as medication is concerned. And you just have to listen. I think that I just want them to know that we know what we're talking about. And if you listen, it'll make your job a lot easier. For the public, what you see is not what you're getting. I mean, I look like I'm the most, my nephew says it all the time, you're the healthiest acting sick person I've ever known. We all have these masks that we have to put on to survive. We have to put on these masks so that it doesn't scare you. If we told you how we really felt, you would probably run away screaming. So for the public, I would want them to know, just realize that what you don't see is not exactly what it is. And to just be cognizant that everybody is going through something. And someone with a chronic illness is just going through a lot more than someone that might be healthy.
Yeah, for me, I'd say to the doctors, stay humble. And it's kind of like what you were saying, Raquel, is they need to stay humble and have some humility, recognize that. Again, it's not like a failure on their part always. Like they can't know everything about everything. So they need to stay open to like learning as they go. Even if they've been practicing 20, 30 years, you still learn, right? Like science is always changing, new medications are coming out. So stay open to learning. The other thing I guess I'd say to doctors is, you know, like you said, just like listen, hold space for us, but also recognize like you're so busy trying to keep us alive. It's also important that we look at quality of life. And that's something my hematologist does because you're keeping me alive, but I have to want to stay alive, right? And part of wanting to stay alive is finding joy and beauty and connection and love in my life. And I, I'll just kind of go off on a slight tangent. So I'm a sex educator, an intimacy educator. That's why it says the intimacy artist. And when we talk about intimacy or sex, I think sometimes there's this misconception with some doctors of like, oh, you're sick, you're not interested. And that's not everyone's case. Everyone's different in their approach. And I've actually seen some people become hypersexual because you're facing death and you're having hard stuff. And, something I say all the time is like our body experiences so much pain. It's also important that we remember it allows us to experience pleasure. And in my own experience of talking to doctors, sometimes I've tried to talk to them. Like I had one cardiologist who, at one point, I was in an early stage of heart failure. And I said, okay, I understand. I said, one last question. Am I okay to have sex? She was like, why would you ask me that? And I was like, well, because you're a cardiologist and your heart rate is raised. And like the disgust and the like it just like affected me, but like not like it didn't shame me because this is what I study. So after I became a photographer, like after everything happened, I really had to pivot and find a new direction. So I became a sexologist. Um, and so it didn't shame me, but what upset me is I was like, her reaction. What if someone had really worked up the courage to ask that question? Because it's important to them, because it's about quality of life, because they care about their partnership with their person, right? Because sex is about more than just pleasure, it's also connection, right? And so I was upset, like, you're not willing to listen. And, that the way that she acted, it could really send someone in a shame spiral. And it didn't me, but like I worry about other people. And so for doctors, again, not just keeping us alive, but recognizing that we need to have quality of life in the process. And that's going to look different for everyone. For people, it's that we don't always look sick, right? I know that, when like right after surgery, I have the handicap placard and I was using it right after surgery. And I had someone actually come up and start yelling at me of like, why are you using this? You're not disabled. And I was like, don't try me today. You know what I mean? And I have a very visible scar in my chest. And I actually just pulled my shirt down and I was like, I just had surgery, open heart surgery. And she was just like, and again, it's like, instead of just assuming that I'm using, like sometimes I use the bathroom stall for handicap people because I need the rails. Because when my oxygen is falling low, I get dizzy. I feel like I'm going to pass out, So, like, there's reasons I'm using it. And so, your assumption that someone doesn't need something because they don't look the way you expect them to look, that's problematic. And that's why I love what y'all are doing with this series, is because I really think it can, hopefully open people's eyes, change their perspective, and allow people to have more empathy and just hold space that, again, like Raquel said, we're all going through something, but those of us who are sick have a little bit more on our plate to go through.
Yes, thank you. And that is definitely what we hope to do here, as you mentioned. And we actually always like to say a little message to you, like you always be kind because you never know what someone else is going through. And obviously, it rings very true for us people living with invisible illnesses, because again, like you can feel entirely different than maybe how you're presenting yourself. But I think it goes for everyone. You really never know what's going on. And so I love how you added that in your little takeaway there. And I love both of the conclusions that you guys shared. I think it's really, really important for doctors to make sure they check their own biases, as well as, again, patients and other people to know, like, hey, you can't judge a book by its cover. There's a lot more going on there. So thank you both so much again for being guest speakers tonight. This was an absolutely excellent conversation. I recognize we totally went over on time. So sorry about that. So I'll try to finish up here real quickly. Um, we do, if anyone maybe has a second or has any more questions, they can send those in the chat. I'm not sure if we'll have the time to answer them. But in the meantime, I will quickly go over some of our announcements. So again, as always, you can watch our previous guest speaker videos on our YouTube channel. And we are always looking for new volunteers and people interested in being a guest speaker. So if you are interested, please email us at info@iianetwork.org. You can also find our contact information on our website, which will be on the next slide. As always, again, follow us on Instagram and sign up for our newsletter as well. And of course, this is our last event of the 2025 year, but we will be announcing our new dates for 2026 shortly. So please keep up to date on that. And our last slide here is just our credits. They were the same at the beginning of the presentation. Again, our Instagram at invisible_illness_network. We also have a specific Instagram for this series, so at invisibly_aware_series. You can follow us on YouTube at IIA Network and our website, iianetwork.org. And you can find all of these links on our link tree to the right bottom corner. Thank you so much again to our guest speakers. We will have all of their information linked in the YouTube video, but thank you again for the wonderful conversation. And I hope everyone enjoys the rest of their night.
Thank you, guys.